Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Founder of Cornwall Cancer Foundation, Dr. Denise Ejo. So good to have you, Dr. Denise. Good morning.
Good morning.
Good morning, good morning, good morning. How are you?
We're very well. So take it away.
Thank you. Good morning, viewers, and welcome to another edition of our Kakaki Cancer Foundation with Dr. Denise Ejo in partnership with AIT. We want to thank you once again for joining us. And we say, let's have a nice chat this morning. This morning, what are we talking about? We're going to be talking about let's reduce prostate cancer through awareness. One of the biggest challenges for me personally is watching the death rates in prostate cancer, which in my view, and we've got a doctor in the house, so he'll advise me whether I'm saying the wrong thing, but in my view, should not be as high as it is. And so we'll be having a chat with him, and let's see what he's saying to us. So at this point, let me start by introducing our special guest today, Dr. Charles Okpani. Did I get it, Dr. Charles?
Well, yeah, fairly. Okpani.
Okpani, I got it. Okay, so I started right.
Yeah.
Oh my goodness, I did a good job here.
You did. Good morning to you. Good morning, viewers. Good morning, the team at AIT. It's a pleasure to be here.
Thank you.
Yeah.
So we want he's married and he's an oncologist with two lovely children.
Thanks.
So, doctor, over to you. Are you ready for me now? Got lots of questions for you.
I'm ready.
You're ready. Okay, so let's go. So briefly, firstly, let's look at the brief facts about prostate cancer and what it's all about. From my perspective, I've already said my views. I don't know if they're correct, but briefly talk us through the diagnostic process of prostate cancer.
Oh yeah, so prostate cancer is a disease that affects males. Of course, males have the prostate gland, which is part of the sex organs. I tell men that you need the prostate to have children. That's one of the functions of the prostate. It produces fluid that helps sperm cells do its work. But we know that with age, as men grow older, they have a high chance of having prostate cancer. It's established that it's more prevalent and more aggressive in Black men, really, both in the US or African Americans or Africans have a higher aggressive nature for prostate cancer. So it's important we should be having this discussion. Now, when it comes to diagnosis, it's an aging process before now. Before now, we had it usually when men are above 65 or 70, but now we're having men even as young as 40 coming down with prostate cancer. A lot of factors are being pushed, maybe environmental, we're not sure really. A lot of studies are going there. So when it comes to diagnosis, I'll take it in two spectrums. The common one is people come when the disease has really progressed. So a man is having issues with passing urine. On the average, you should sleep throughout the night without waking up to pass urine, or maybe once or twice. But a man is noticing every night 4 or 5 times he has to go and pass urine. It shows that urine flow from the tank, which I call the bladder, is being obstructed by the prostate. And that is an indication that, look, the prostate is increasing in size. But that in itself is not a diagnosis of prostate cancer, because even an age also can make the prostate increase in size. But when usually it's associated with other features such as back pain or blood in urine or person losing weight, then we're thinking of prostate cancer. But I want to go more for the diagnosis before it gets bad. And what we are pushing for right now is screening for prostate cancer, which is just a simple blood test, which is called the PSA test. Now, why I say this is that because the gland is inside the bladder, right under the bladder, inside the stomach there, it's very difficult to see it until the disease has gotten advanced. That means the cancer has already spread. And all of us know that it's best to catch cancer when it has not spread. So the push for diagnosis is screening. And what is screening? You do a blood test called PSA. It's a substance that the prostate produces. Now, when that substance, that value of that substance is high, PSA in the blood is high, it gives us a suspicion that, look, we need to take a closer look at the prostate gland. And that will now indicate you see your urologist, who will now do a physical examination on the prostate, do a scan, and also do what's called a biopsy to take some tissues from the prostate to be examined under a microscope. So the key push here is PSA for diagnosis. Okay, I'm trying to summarize as much as I can.
Oh, no. But you see, when we're talking to the public and you're talking to people like us, although I may have doctor, I always say this at somewhere in my name, I'm an educationist. I'm not a medical doctor. So I'm pushing you from that perspective. Okay.
Yeah.
Okay, I'm going to go to another question, but let me ask the other question before I come back if you haven't addressed it in the next one. Okay, so now, based on what you said, can you talk us through the treatment options? Because I want to see if what I'm looking for comes out. If it doesn't come out, I'm going to come back on it. What would be the treatment options from this?
Okay, so when the tests are indicative that they may be prostate cancer, the way to confirm that a man has prostate cancer or not is to do what we call a prostate biopsy, which has to, with a needle, we take some tissues. So if that now confirms it, the treatment options differ. And if it is early, now early means that the man probably has been doing his PSA once every year. We notice it's rising and we catch cancer early. That means the cancer has not spread outside the prostate. Imagine the prostate is an orange. An orange has a back and then the substance we eat inside. So we want the cancer to just remain within the substance and not spread outside the back. So at that stage, treatment-wise, we can cure it. And we can cure it by doing a radical surgery to remove the entire prostate gland and the associated structures that are close to it, or we'll do radical radiation therapy to burn it off. So this is really the push. This is the best. It's curable when caught early. But if not caught early, and I'm sorry, it's a pity to say that over 99% or we're 95% now in Nigeria of prostate cancer cases we see, we don't catch it early. At that point, what we are now doing is to now suppress the cancer because we can't catch it early. We can't cure it completely rather because we didn't catch it early. So the suppressing of the cancer has to do with giving drugs that either destroy the cancer cells or take away the hormone or food source that make the cancer grow. So so there are a lot of drugs that can be given, a lot of surgeries that can be done, but this is the summary of it. The summary is two arms. One, you caught it early. The man was doing his PSA screening. We noticed the PSA was rising. We swung into action, did tests, which include, like I said, a physical examination, a rectal examination. We did a biopsy, some other scan tests that confirm that the cancer is there but confined. We go to cure it. We do surgery to take it out completely, or we give radiation therapy to burn off the cancer. Or the other arm, we didn't catch it early. It was when the man already had symptoms. Maybe he came with low back pain, or he couldn't pass urine. And then in the process, we now discovered that, there's prostate cancer, but it has already spread beyond the prostate. In that a case, we are doing suppressive treatment. So that means we are not clearing the cancer completely from the system, but we are doing everything to suppress it so the person can live his normal life. And that's through either giving drugs or some other surgical options to do that.
Okay, so looking at the giving drugs, because one thing that I've found that is a big anxiety for a lot of people, and I was very surprised to find that the word chemotherapy.
Yeah.
it was shocking, even in the UK for me. So it's not about Nigeria. It's about everywhere in the world that a lot of people see chemotherapy as wow. It's a no. So do they take chemotherapy? Do they take chemotherapy with this disease, with this treatment?
Yes. Yeah. So is that, look, once they tell you need chemotherapy, that means that they are saying that your time to die has come. I think that's really the problem over time. And like you say, it cuts across cultures, it cuts across countries. Okay, but I think we have to start changing that narrative that, and there's a lot of advancements in how we give chemotherapy. Studies are going on every day to make sure that people receive chemotherapy in a safe manner that will do the job of killing the cancer cells and have little adverse effect on the person taking it. So yes, they receive chemotherapy, and yes, it is safe to receive. And we as the doctors will always make sure that it's the best thing for you to receive for your care.
Awesome. You see, you've answered the question I wanted, because the next question I wanted to talk about is lifestyle. And based on what you said, okay, I'm trying to be very polite about this because, rather, I don't know how to explain it, but a lot of people, men, would not take all these treatment options because of the risk of not being able to do their manly duties as a husband, a partner, their children. And one of the biggest challenges for me in my head is I'm not understanding why men think that the best option is to let it grow to that point where it becomes a big challenge, and therefore leave a family on their own to sustain their lifestyle. Because I think that there are two ways to it. A woman will take off her breast and not think twice about it, except her husband tells her why she will not be a woman. But a man, the way the women think and the way men think are very, very different. And it is a big challenge. So can you talk us through lifestyle changes that can help navigate the patients?
Yeah. So part of the treatment really is, like I said, withdrawal of the male hormone, which is a fear. But the flip side is really that one of the complications or the problem that the cancer brings about is actually affecting the man's ability to do his function really. Because when the cancer spreads outside the prostate, very close to the prostate are the nerves that help a man have, I'm on TV, tumescence, or ability to meet his wife, really, okay? So once that nerves are affected, already that functions are affected anyway. So usually I think it's an understanding of what exactly is going to happen, because what a man is trying to preserve is already going to go, whatever the case may be, because of the disease. But from the perspective of treatment, even if the treatment affects that, there are things that you always can do that can support a man to see the ability to still carry on the function, not as optimal as you can, but as a level that is still acceptable. So it's doable. So yeah, so lifestyle is also important for prevention. Although not 100% established, some factors such as increase in STDs, smoking, have also been implicated, not indirectly, to say that they could increase prostate cancer risk. So it's important that that is brought to play also. And I would just want to add this. Really, I've been seeing a video going around about a lady talking about how often a man meets with the wife affecting cancer or not. All those factors. Really, nothing has been proven scientifically. A lot of studies have come out to say a lot of things. Some studies say a man that meets frequently with in a month will have less chance of cancer. Another study has said that those who have multiple partners have increased chance of cancer, but nothing really is cast in stone. You know, when you have different opposing studies, you can't say. But what we know is that reduction of STDs, a reduction of STDs, regular partner, which will reduce STDs, healthy living, really, avoid smoking, reduce exposure to different things that cause cancer in our environment are all things that may reduce the risk of prostate cancer significantly. And studies are being on to see whether that's the reason why we're having prostate cancer at younger ages, really, compared to maybe 10, 15 years ago. So it plays a role, and I think it still goes back to the processes we talk about as younger, balanced diet, really, avoid those environmental hazards. Those that work in radiation zones have to have a radiation counter just to make sure that they can reduce their cancer risks. And then importantly, family history. For those who have had a brother or an uncle who has had a diagnosis of prostate cancer, you have to have increased you have an increased chance of having the cancer. So you have to just take your screening more seriously. Even start screening at a younger age, maybe as young as 35 years. So it's important to know that. Thank you.
Oh, thank you. That was. I've just got two more quick questions for you, and one of them was quickly to do with screening.
Yeah.
Based on what you've explained, so I just want to make sure, I wanted the message to be very clear. Based on what you've explained, screening the PSA, doing the PSA test.
Yes. So screening is so it just one or two mils of blood put into a machine, and it gives a value. And let me state out there that some laboratories do what they call qualitative PSA. So they do it like a strip test. I said positive or negative. And that test has not had a very good correlation with screening. When we talk about screening, it's to get a quantitative value. So we know that the normal PSA is between a value of 0 to 4. There's a unit, of course, 0 to 4. So usually we expect for different age groups to have different cutoffs for PSA. Okay, so screening means that you try and check your PSA once every year. And if there's an increase, then the urologist has to come in to do a more in-depth check. Now, let me state that increase in the PSA doesn't necessarily mean that you have prostate cancer. There are other things that can increase the PSA, or if there's infection in the urine. But PSA screening is the best tool to be able to increase our detection rate for early cancers. So what I usually advise every man as a birthday gift for yourself, do a PSA amongst other checks every year.
Okay, now you're going to do me one very quick thing before we make our closing remark. If I gave you a blanket check and I said, give me 3 requests, one for a patient, one for the medical people, that's people like you, and one for family, friends, or an NGO. And bearing in mind that, various people watch this program, can you please give me 3 very quickly, a blanket check?
Okay, so first for patients, for men above 40, check your PSA every year. Prostate specific antigen, the test costs maybe between 7 to 11,000. I think for your health, it's important. So check that once every year. Now, for the medical, we in the medical field, we need to increase awareness, and we need to organize programs for screening. We need centers. I'm trying to do that in my center where a man can come in and he has a package for a screening per year that's towards prostate cancer. So something that just tells him this and this is your risk. So we need that, and we need to increase awareness. Now, for the community, we need to encourage people to seek expert medical care. We should not stigmatize those who have diagnosis of cancer, not just prostate cancer, but we should support them. It is not a death sentence. It's a life process. People are living their lives abnormally, and we can do that also. So support, family support, church support, psychological support is so important. The NGOs can come in to form support groups among people who have diagnosis for them to have better care and psychological support. Thank you.
Thank you very much. You answered my last question, because I was going to ask you what would be a piece of advice that you would give all of us, and you just sorted that out well. thank you very much for joining us today, and to all our viewers. Together we fight, together we win. This is a battle, but we will win it. If we don't, then we've not done ourselves we've not been fair to ourselves. So you can follow us all on Commonwealth Cancer Foundation. You can find us on our social media pages. I think it's all of them actually. They're all working. So you can find us on any of them. Commonwealth Cancer Foundation. Dr. Charles is actually out in River State, so you can actually find him. And if you just follow us, you will find the videos will go online for you to watch, and you can actually go and get some messages and share it, because that's the only way. Together, we have to fight this battle together. If we share and we educate each other, then we're going to help each other. You can find us anywhere. Dr. Charles, I want to say a very, very big thank you to you for actually taking time out. And I'm coming back to you again, because our viewers always ask for specifics. And once they ask, I tend to realize that, yes, that means that there is a bit of concern, and prostrate is a big concern, please. And to all men, please, we're begging you. We as mothers, we want you guys to be okay. So, and wives, please do this prostrate. If it's the one birthday gift that you give yourself, or wives, maybe you start giving your husband a birthday gift of doing a prostate check. Maybe that might be our solution. You can always find us. So thank you for watching us on AIT this morning. And for AIT, I want to say a very big thank you. Our champions, always there for us, always helping us to navigate this journey, always being with us. We appreciate you. We appreciate your support. And to all of you, have a fantastic morning. Dr. Charles, thank you.
Yeah, thank you for having me. It's a pleasure being here. Thanks to AIT and to your foundation doing fantastic work. I appreciate that. We appreciate
Thank you.
All right.
Have a good day.
All right, you too, ma. Bye.
Bye.
Professor of epidemiology in Harvard has stated through findings that ejaculating more than 20 times a month reduces prostate cancer risk by 20%, especially for men from the ages 30 and upwards to 40 and above. I don't know how true that is, but on a scale of 1 to 5, Perry, what would you consider would be the ejaculation rate for a male from 30?
How am I supposed to know?
If you're male, all you gender. We'll take a quick break and we'll return.